Hello! Welcome back to my channel in English for Nursing Communication 2. This is Ruffel Manalo from the Faculty of Nursing, Nakhon, Pathom, Rajabhat University. So I will discuss to you the Unit 12 of this course, How to Communicate with Patients in the Medical Ward as the subtopic. So once again, this is a team teaching course taught by the three of us from the Faculty of Nursing, Nakhon, Pathom, Rajabhat University. Alright, so the objectives of this includes understanding of the different mode of transmission, determination of the infectious disease group, identify the different samples used for testing, analyze the benefits of different vaccinations, and apply the steps in preventing the spread of infection. So this is timely in our current generation COVID-19 era. So at the end of the lecture, the student also will have a practice test in a separate worksheet. So as an overview, according to American Academy of Pediatrics in 2006, infectious diseases are illnesses caused by germs or microbes. It is very important that not all germs such as bacteria, viruses, fungi, and parasites can cause diseases. Not all infections are contagious or not able to spread from person to person. So as you can see, based on the overview, the topic that I'm going to discuss in this particular unit of the course is about infectious diseases. So I will focus on this. Right. So first we'll go to the terminology. So we have infectious, shiver abroad, contact, contagious, scratch, fever of unknown origin, sore throat, rhinorrhea, diarrhea, blurred vision, sepsis, bite mark, droplets, like antibiotic, hygiene pathogen, mucous membranes, immune system, white blood cells, antibody, bacteria, virus, communicable diseases, epidemic, pandemic, allergy, asepsis, contaminate, immunity, susceptible, transmission, inoculate, and prophylaxis. So you get there the different meaning from the terminologies. So you can go for this one at a time at your own pace. I have here 34. Okay. So these are the most common terminologies. I just choose this for our topic in this unit. Right. There's more coming. So as you can see here, I did not skip any single terminology. It's because they're very useful in discussing infectious diseases. All right. Almost there. And the last one. So please study this again at your own pace. So let's discuss first the mode of transmission. So indirect contact, it could be person to person, animal to person, mother to unborn child. So the child can even get get infected, should I say, while inside the uterus of the mother, and also fecal oral contact. So for the indirect contact, we can get this from tissue papers, utensils that we use when we eat, okay, toys for children, or even keyboards for us who are working in the office or anywhere in our setup nowadays. And for the droplets or airborne contacts is very common nowadays. Coughing, talking, sneezing, and spitting. Okay, so take note of this one. I just choose common infectious disease group, and for viral, this includes HIV/AIDS, chickenpox, herpes, simplex flu, RSV, gastroenteritis, measles, rubella, dengue, hepatitis, Ebola, yellow fever, viral meningitis, and what are we having now is the COVID-19 viral infections spreading all over the world. And we also have bacteria. Okay, for the bacterial diseases, this includes bacterial meningitis, tuberculosis, gonorrhea, salmonellosis, typhoid fever, UTI, chlamydia, pneumonia, Lyme disease, cholera, botulism, tetanus, and anthrax. And for the parasite, malaria, amoebiasis, ascariasis, pinworm, tapeworm, roundworm infections, scabies, toxoplasmosis, trichomoniasis, giardiasis, pubic, and head lice. And the last one, fungal. Fungal infections includes candidiasis, tinea pedis, yeast infections, ringworm, thrush, athlete's foot, fungal meningitis, in black fungus. As we have seen now in India nowadays, that after the Delta variant surge of virus about this COVID-19, black fungus came out to some patients, and most of them got blind, and the black fungus is really destroying their um, body. The common samples used for testing, I choose only the most commonly tested or used for testing, samples used for testing. We have blood, sputum, urine, stool, tissues, okay, CSF or cerebrospinal fluid, and mucus from the nose, throat, or genitalia. And as you can see nowadays, this is very, very common when we perform a swab test to determine the presence of virus, COVID-19 virus from a person. According to World Health Organization in February 2021, these are the common vaccines that I have listed here. We have cervical cancer, pertussis, cholera, pneumonia, COVID-19, polio, diphtheria, rabies, hepatitis, rotavirus, influenza, rubella, Japanese encephalitis, tetanus, measles, typhoid, meningitis, and varicella, mumps, and yellow fever. Those are the list of vaccines that are available according to World Health Organization. Currently um, posted in February 2021. Right. How do we prevent the spread of infection? So it's very easy. Wash hands, get vaccinated, only take antibiotics when necessary. Okay, maintain good hygiene, practice safe sex for sexually transmitted infections. Um, don't share personal items. Keep your pets healthy and clean. And of course, avoid contact with those who have contagious disease. So it's very common. We practice most of this in our daily routines because of the current pandemic um, in our area and even the entire world. So to conclude, with profound study of infectious diseases, we better understand more about how the body's immune responds to a disease, work out how to prevent the disease or improve its treatment, test the effectiveness of potential new vaccines, just like what we have now. We have COVID-19 vaccines, and it's nice to know that people are very submissive to receive the vaccine so that we can achieve herd immunity. So also treatments and monitor the performance of approved vaccines and treatments in the real world. So I don't have to explain in details about the pathophysiological processes of certain diseases here. However, you will have that in your own class discussions with other professional nursing subjects. So as your practice tests, here you have to answer um, a test in a separate worksheet towards the end of the lecture. Then you have to send it back to your lecturer's email address. So thank you very much. If you have any inquiries, please don't hesitate to send your messages through my email, line, or Facebook account. So see you next time. Keep safe.